All right, welcome back. We've got Dr. Vigoren again, and we're going to be kind of rewinding the clock. Instead of focusing on adults, we're going to start with children and infants and how the early development affects our airway and our dental health. So, Dr. Vigoren, please take it away.
Okay, well, I was just at a baby shower and I was talking to a group of people about this. And I realized that the most fundamental thing we can do in integrative, systemic, regenerative medicine is to stay healthy in the first place. And there's a foundational coupling here between oral development and systemic health. And it starts at a it starts at birth. And it has to do with your ability to breathe through your nose when an infant is nursing. And when a mother can't nurse, it's rarely the mother's fault. It's either a frenum attachment or a tongue tie or a highly vaulted palate. And for instance, in Brazil, if the midwife or the OB doesn't separate the palate after birth, because it folds together, so it comes through the birth canal. If they don't separate it, if they don't rake the frenum and don't rake the tongue tie, it's considered malpractice. And here we don't even look at that. But then the follow-up is, and that allows the baby to latch, and that allows the baby to reach the roof of the mouth and develop suction, which allows them to extract the milk after the free lunch, which is a letdown. Okay.
Right. So before we go on, just to review anatomy so everybody is with us, when we say the palate, what we mean is this area. If you take your thumbs and put it just on the roof of your mouth, that's the palate. So we're talking about spreading that palate out. The frenulum is this area. If you lift your tongue and put your tongue to the roof of your mouth, it's what keeps your tongue attached to the floor of your mouth. And for certain infants, that can be very tight and short, and that can be snipped in order to elongate it and to free the tongue. So those are the two structures that we're talking about.
And then the frenum, when you pull the lip up or pull the lip down, that attachment that you see, that's the frenum. And if the frenum is too tight on either the top or the bottom lip, the baby can't latch onto the breast and can't get good suction. And then if the tongue is if they're tongue tied or their tongue is can't reach the roof of the mouth, they can't generate suction. And if the palate actually folds together, and so this this separating of the palate is really just pushing the two sides back out. And that allows the baby to nurse. But now nursing itself develops a strong tongue and takes time. But that's the stimulation that pushes the front arch or the front teeth out, or where the front teeth are going to be in the bone, and separates the bone in the back where the teeth are going to be. And without that nursing, we don't get that we don't get that growth and development. And you talked about the palate being what you could feel when you put your thumb on the roof of your mouth. That palate is the base of the nose. And that palate, when you look at 3D x-rays, cone beam x-rays, you see almost everybody in Western civilization has a deviated septum from top to bottom. And this is way back in the nose. It has nothing to do with sports injuries or a bloody nose or getting hit with an elbow. And it's deviated from top to bottom, and it's deviated from front to back because the force of the tongue in nursing projects the upper arch forward and spreads the upper arch, which then gives space in the nasal cavity. If this is the brain and these are the molars, if they're narrow, you have a one-bedroom A-frame with 3 bedrooms worth of furniture. And if you spread the palate, it looks like this, and the nasal breathing goes through the charts, up to 8 times the airflow of
Wow.
this, okay?
Yes.
And so um, if you take that back, it is the most modifiable health foundational thing that can be corrected in society. And it's a result of our diet and lifestyle in Western culture that we do not nurse for 2, 3,
Mm.
4 years. And we don't transition children off of, excuse me, we don't transition children off of uh, mother's milk onto hard foods. We transition them onto liquid calories that don't take any chewing, and pureed foods that don't take any chewing, and overcooked foods that don't take any chewing. Because every mother I'm positive it's in the DNA, is afraid that their child is going to starve. Okay,
Right, right.
and that's
And
why.
and could you and
Yeah, go ahead.
could you expand upon how important it is to have harder foods to chew on? Why that is important?
Okay. The nursing starts the process, and the development of a strong tongue in nursing starts the widening of the bones and the stimulation that widens the bones, and the forward protrusion of the upper lip. Okay. Now, people that have big noses may not have big noses. They may just have a recessed lip. And people that
Hmm.
have a bump on their nose, that's an elbow. If the upper lip went out, that nose straightens out. You got a nice straight nose. And so
Yeah.
plastic surgeons for years have been cutting off your elbow because it's got a bend in it. It's got a bend in it. And all you have to do is put the arch in the right position. And so the earlier you do this and the earlier you intervene, the less traumatic it is and the less problems it causes. And it allows infants and children to to ventilate when they sleep. And this,
Hmm.
it's related to SIDS. I'm sure that its cause of sudden infant death is when an infant can't breathe through their nose, and you know, and that's why they have all these positioning rules. And instead of having video cameras to look at your child, your infant, they should have a pulse ox meter that tells you when the child is not ventilating. Okay.
Yeah.
And the alarm goes off, and then you shake the child, and and we could eliminate a whole lot of problems, tragedies. But back to the growth and development. So you asked, how does the chewing hard foods influence this?
Yeah.
It stimulates the bone growth to widen.
Hmm.
Okay. And so the problem with orthodontics for the last over 100 years now is that the teeth are the right size. The teeth aren't in the wrong place. The development of the bony arch is underdeveloped. And so you don't have room for the right size teeth.
Mm.
And so the orthodontics evolved to straighten these kids' teeth, when what they really needed was better growth and stimulation and development of the bony structures that house the teeth. And so that's the start of understanding this. And and there are many books, Breathe and Jaws, and Weston Price's book about the difference between uh, primitive Africans and European Caucasians. And if you look at the skulls of and people, you can study 600 years of skulls, and the back of the nose was this big. And the Kenyans and the Ethiopians who win marathons, the back of their throat is this big. And if you're raised in Western civilization, even if you're from Kenya or Ethiopia, on Western diet, you get the back of the throat that's half the size. They run the
Hmm.
entire race with their mouth closed, producing nitric oxide through their nose, and they run across the finish line with their mouth shut.
Mm-hmm.
And that diet, even though we consider it to be primitive, is much healthier long term. So now let's come forward and assume that you didn't get the nursing, you didn't get the hard foods, and you have an undersized upper jaw, maxilla,
Yeah.
where your upper teeth are.
This area right here.
Yeah. Instead of trying to straighten up the teeth and take out teeth and even expand the arch, you're frequently moving the teeth out of the bone because the bone's in the wrong place. And so now what we're doing is we're using the same types of expanders that go actually into the bone. And it sounds terrible, but it's very non-traumatic. It can be done on a 10, 11-year-old with just local anesthetic. And the separator, instead of separating the teeth and trying to widen the arch, it actually screws into the bone in the palate. And now when you do the separation, turning the crank, you're taking the palate and you're separating it, and all that separation goes into airway in above the palate in the nose.
Mm-hmm.
Okay, it is dramatic, the change it makes in people's energy levels and how the quality of their sleep and their ADD and ADHD and depression and I mean, people have been carrying 50-pound bags of weights around.
Extra weight. Yeah.
Yeah, and they're still succeeding, but they're having all kinds of 30 or 40 different problems or symptoms that are related to that underdeveloped airway from infancy.
Yes. Yes.
It includes asthma, inner ear infections, the need for tubes, the esophageal Barrett's syndrome, all the all the things that we don't look at from a nasal breathing standpoint, from a sleep standpoint, all go back to this. And it's in somebody that's already developed the bone, it's a dental, orthopedic, orthodontic problem. And so that's how we're treating it. And what used to take orthognathic surgery, that's a 10, 12-hour surgery with 2 surgeons. And, it used to be $110,000, and now it's much less. But, there was a 3 to 6 month recovery for that.
Wow.
And your jaws were wired together. Okay. Or you had surgical plates put in that underneath the tissue with screws. And so now what we're doing very successfully is we're doing it in 2 90-day segments, and we're getting airway improvement almost immediately. And the icing on the cake is the teeth come in and have plenty of room and are straight. Okay. So while the palate, the bone in the roof of the mouth is being separated instead of the teeth being separated, and the teeth go along for the ride now. And so
Right.
they're actually wider, but the key to this is the floor of the mouth widens, and that's the floor, or excuse me, the roof of the mouth widens, and that's the floor of the nose that you need as an airway to breathe through. And it you can very easily test this, and that's breathe hard as you can, put your fingers right here, separate it, breathe again, and you can feel the difference. That's what the Breathe Right strips for athletes do and for sleeping at night. But that's just the first valve. And the bony housing is the second restriction. And then the structures inside the nose all the way back to the throat are the third structure that's influenced by this underdevelopment of the bony housing of the airway from the tip of your nose to the back of your throat.
All the way to the back.
All the way
Yeah.
to the back. Now, we talk about apneas, and apneas are when the throat collapses or the tongue goes back.
Yeah.
And we talk about snoring. Snoring and apneas are really more symptoms than causation. It's the negative pressure from this restricted airway in the nose that causes the latex hose, our swallowing mechanism, to collapse under negative pressure. And that's why your brainstem wakes you up when you desaturate in oxygen. Your oxygen level goes down on the hemoglobin, and it says, clench your teeth together, you're killing me, Smalls. And the throat flexes, the muscles in the throat flex, and you breathe again. Now you just keep repeating that cycle, and it's terribly disruptive to the quality and the regenerative process of the brain at night. It's terribly disruptive to learning and memory. It's terrible, I can't believe people are as successful as they are and they don't sleep well at night.
Right. But besides having all of those issues, they're still trying to function throughout the day without getting the restorative sleep that they actually need. And this is happening over months and years for a lot of folks.
Yeah, and a lot of successful people just learn how to drive the machine harder, caffeine and stress and most type A individuals, most ADD individuals, most very high percentage of successful individuals have this underlying problem, and they just learn how to run into a brick wall until they can't run into the brick wall anymore, and then they have all kinds of health problems that stop them from running into the brick wall. And,
right.
and the origin is understanding, or causation is understanding that this is a basic airway ventilation problem in sleep that is interfered with by bony housing structures not being stimulated or growing to the genetic potential. In other words, what you were supposed to have.
Right.
And then that high vaulted arch, narrow arch, doesn't have enough room for the teeth, i.e. crowding, and the lower arch now can't grow forward because it's growing into a shoe that's too narrow. Okay, and so if the teeth were wider, it would grow further. And so most Western culture, Western diet, Western civilization are up to a ½ inch narrower in the molars from any skulls or x-rays or that we look at that are more than 100 years ago. And same thing with the protrusion of the upper lip and the chin. They're retruded ½ an inch up to 3/4 of an inch.
Well, so this is really, a lot of this is changing. It's also changing the appearance of people. So what I'm imagining is you're getting these faces that are narrower, they're longer. And they're also shorter, right?
Yes.
It doesn't protrude out. So you're getting changes in how your smile, how your teeth and your gums show when you smile. You're getting changes in your nose. You're getting changes when you get older. You're getting changes in these lines, the laugh lines and wrinkles around the mouth that you wouldn't normally have if your maxilla was out further and your nose was developed the way that it's supposed to.
It was, the bottom of your nose was in the right place, which is probably supposed to be 1/4 to a ½ an inch further out.
Yeah.
And there are no mammals that can survive, that can't breathe through their nose while they're nursing or when they sleep.
Mm.
Animals don't snore. And people all say, well, I'll get this implant in here that shocks me when I snore. Well, that's just treating a symptom. It isn't treating the
Right.
causation. Causation is you need more air. The things that will once we diagnose this, and we do it with as many areas as we can to come up with a very, very strong justification for doing this treatment, because not everybody agrees that it needs to be done. And so you have to overwhelm people that don't have this in their wheelhouse with data so that they can't say, well, that's not true. You don't need that. And so we put together so much data that it's overwhelming. And one of the things we're looking at is we're looking at their high resolution pulse oximetry. In other words, how much oxygen do they have on their hemoglobin when they're trying to sleep? And they should be saturated up to 97,
Yep.
96, 97, 98%. Well, we see people going down, my son-in-law desaturated down to 61%.
Oh, wow.
That would kill
Yeah.
the infant
That's horrible.
or 70-year. But and the sleep centers are not looking at this from a perspective that is less than 50 years old. And that's because the reimbursements, insurance reimbursements, are built on guidelines that are 50 and 60 years old with equipment that was low resolution. It's like going to the Olympics and and timing the 100 off the minute hand on your watch. It's just we've moved forward with technology, but the cone beam shows us that inner nasal passageway all the way from the tip of the nose to the back of the throat, and we can even see the throat size. And when the chin comes out, it opens up the throat, and it doesn't collapse as easily.
So can you explain for folks what the cone beam, what kind of imaging that actually is?
It's an extremely low radiation, high resolution, very quick rotating instrument that goes around the head. And now, instead of the expensive high radiation cone beam or computerized tomography, CT, that they have at hospitals, this one gets higher resolution at a fraction of the radiation and a fraction of the time. And now we can go through and we can look at a plane from front to back and from side to side and from top to bottom. And the diagnostic ability of that is
great.
Yeah, and the patient can see it. I mean, we get 10-year-olds that can diagnose their own orthodontic problems off of this thing. They can see that I just don't have room for it. That's the other thing, is the lack of room for wisdom teeth is just because the upper arch doesn't get protruded forward. It doesn't allow the lower arch to grow forward and give you room for all 32 teeth.
Right. Yeah. And I should add, you've got this imaging in your office. And so it is very quick. You just sit in a chair, you have something rotate around you, and then within 5 minutes, you're actually looking at, you can see all of your teeth, you can see the back of your throat, you can see the spacing that he's talking about going far back into the throat. Almost, you think it's your neck, but it's actually the back of your
You
throat.
get a 3D image all the way from your forehead down to your collarbone, basically, and you can rotate it and slice it and look at any level. So the cone beam is a great diagnostic tool that we have not been using for this, that sleep medicine does not use for this.
Mm.
And high resolution pulse oximetry recorder, if you go in one night, or we used to do it with low resolution for just one night, and we found that if we didn't do it for multiple nights, we didn't get good readings. And we found out that the low resolution, difference between the low resolution and the high resolution, it's just the frequency with which it's sampling. You didn't pick up half of the problems in the low resolution that you pick up in the high resolution. And the high resolution pulse oximetry is not used in hospital emergency rooms, in the intensive care. It's only used by the anesthesiologist because it's important to him to get the data right away. He can't go on low resolution data. He needs to see what's happening instantly. And the brain and the physiology can recover so fast for people that have these issues that you just don't pick it up. Okay. But what I was going to say earlier was there are 3 workarounds for this. There are 10 things that you can do that improve it. But the 3 workarounds that have been most successful, and 2 of them are 100%, and one of them works a lot of the time. One of them is the jaw positioning device that you hear about, that's advertised on the radio. It just holds the chin forward. Well, that pulls the tongue out of the back of the throat. And for a lot of people, can get them breathing better in their sleep. I mean, instantly. We use that as a diagnostic tool, or just a temporary one, to validate that when we do that, they breathe better, they sleep better. Okay. The second one is orthognathic surgery. That's the 10-hour 2-surgeon, $50,000 to $100,000 7-piece surgery all at once.
Wow, yeah, that's extensive.
Yeah, and then a full face CPAP, properly adjusted, gets around it. And it's you're supposed to have an Arcadia window on your cruise ship to get plenty of fresh air, and down in the luggage section with the porthole this big. Well, how do you get the same ventilation that somebody with a big airway has? Well, you put a fan on it, and that's all a CPAP is it just increases the pressure through this, and it stops tissue from collapsing. Yeah. So if you don't want to wear a full face mask CPAP the rest of your life, or you don't want a dental device that holds your chin forward, that causes structural problems with how your teeth come together in a high percentage of the people 3 to 5 years later. Then you can't chew with your teeth because they don't come together. This third way is to do it with a bony palatal separation that instantly gives improvements in airway, and that's a 90-day cycle combined with clear aligners, Invisalign type aligners, because as you're separating the palate, your front teeth separate, and so it's very easy with clear aligners to correct that, because you're going now through very soft bone, and what might take 18 months to 3 years now, you can do in less than 90 days.
And what's great about that is you're solving the underlying structural issue rather than forcing airway through soft tissue that is always going to be the same, or doing something that's moving your chin, and like you're saying, it's going to eventually disrupt your teeth.
Your jaw muscles, your jaw joint, your teeth, the alignment of your teeth. It can be a problem with that, and so we actually go through all these options, but we want to get baseline data before people do anything, because otherwise you can make it good enough that somebody says, well, they don't need to go any further. But when you do palatal separation in the first phase, uh, it's so dramatic to the patient's perception of sleep and reality that you can't stop them from doing
The rest of it. Yeah.
the rest of it.
Yeah.
And I said it's divided into three parts. One is to separate the palate. The second part is to upright the lower arch, so it aligns with the new upper arch. And the third part is to move everything forward. Well, greater than 50% of the time, you don't have to do the third phase because you corrected the airway collapse in the first phase.
That's incredible. Yeah, and you're not, and just for thoroughness, are there side effects that you see? Are there complications that you have experienced with this procedure?
Well, you have to wear the trays. You have to you have to have bought in to the concept, and that's why we try to document, and we go to so many different areas to look at symptoms. And when you list all these symptoms, people go, "Oh my God, I didn't know." I had no idea that was related to this. And then
Right.
when you treat them with the temporary jaw placement device, for just a week or two, and they feel so much better and they sleep so much better, they're on your team then. They want to go forward.
Yeah.
And
Yeah.
so the the amount of disruption or discomfort associated with this is really minimal.
Yeah.
Minimal compared to the things that they're going to have to go through because of this.
Right. Right. And
it's
for the adults, the medical issues can be significant. So a lot of people just think in terms of sleep apnea, but you mentioned the reflux. I see people with hypertension. The hypertension can lead to strokes. It can lead to congestive heart failure. It can harm your kidneys. And so now, because this hasn't developed correctly to its potential, now you've got systemic issues from head to toe, from your brain to your kidneys. Whereas
it affects
within
everything in the whole system.
Yeah.
Correcting this could lead to 2 to 5 decades of health span, not just lifespan, but a healthy extension of lifespan.
That's what we all want.
Yeah, and it is the biggest single correctable longevity health problem in Western civilization. It's related to weight gain. It's related to, I can see somebody on the television and diagnose, especially with males, big jaws, no chin, and abdominal obesity.
Yeah.
It's almost 100% diagnostic, just those three things, that they have airway ventilation problems that they've had since they were born.
Yeah. Yeah. And that's unfortunately becoming more and more of a body habitus that you just see on a regular basis, whereas that used to be rare in the past.
Right. And with women, it's a long face, high anxiety, and broken teeth, decay. How is decay related to your breathing? Well, when you don't sleep well and you don't get regenerative sleep, you crave carbohydrates. Junk food junkies and people that crave sugar, the brain can go without glucose or without regenerative sleep. But if it gets regenerative sleep, there isn't the big craving for carbohydrate.
Yeah.
And so we're relating almost all dental wear and bruxing and temporomandibular joints problems, head and neck pain problems, to this clenching people do at night to flex their
jaws.
Flex their airway. Their airway collapses, and then their brainstem says, "Wake up! You're killing me, Smalls." And you swallow, and your airway opens up until it collapses again. We have people that are collapsing 80 times an hour.
Yeah.
When
And
I
that is so stressful. I mean, it's a survival mechanism, but it's so stressful. And now you're producing more cortisol, which is
and
a
more
stress
adrenaline.
hormone. Yes. And so you're waking yourself up, but you're in this fight or flight mode when you should be sleeping and resting. And
That's right.
so it's, this is where we see the hormones starting to drive, and create, like you said, the weight gain or the anxiety or increases in blood pressure. All of these things are stemming from your brain is trying to save you while you're sleeping.
Well, your next breath is the number one goal of your brainstem.
Yeah.
You can do everything. Uh, you can put it off till later, except that next breath. And so your brainstem is constantly sacrificing other tissues and functions and organs to get you that next breath.
Yeah.
And all you have to do is separate the palate, you know, eighth of an inch, a quarter of an inch, and all that space goes into the ventilation, the airway, the structure of the from the tip of the nose to the back of the throat, and relieves the negative pressure that contributes to the soft part of your throat collapsing. In other words,
Yeah.
think of a fire hose.
Yeah.
And when it's down on the ground, it's flat. When it's got pressure in it, it's big and it's hard. Well, you don't have liquid in your throat. You have muscles on the outside that that flex and open it up, and that's what you use to swallow, that peristalsis. And so that clenching of your teeth and swallowing opens up the airway temporarily. And that's what your brainstem keeps doing. And that's why there's so many dental problems that are related to this airway issue, is because, you could be clenching your teeth in a death grip, hundreds and hundreds of times every night.
Yeah. Yeah. So with what you're doing, we've been talking about adults. What happens when you have someone who is in their teens still growing? How do you approach someone of that age group?
Same thing. It's the same data. It's the same evaluation. It's the same spread of the palate. It's
Okay.
just easier. It's much easier in teenagers and young adults.
Okay.
But we used to be able to spread.
Tracy Tanner, +1 7.
Excuse me. We used to be able to we used to be able to spread these to say 24 to 27 in males, and to maybe mid 30s in females,
Okay.
with just the spreader and 2 titanium micro screws into the bone. Okay. Now, by the way, it sounds terrible, but we can do it with local anesthetic on a 10-year-old. Okay.
Okay.
And,
It does sound a
they
little
can go play
scary.
soccer right afterwards. But then we went to 3 screws on each side. Oops, 3 screws on each side, and we could go up another 10, 15 years on everybody. And then we went to 4 screws on each side, and now we can practically separate any palate. And it's just a quarter turn, with a little crank, the same thing that they've used in orthodontics to separate molars. The problem in orthodontics is if you do this too fast and the child is not growing, you can move the teeth right out of the bony housing, because the problem isn't the teeth are in the wrong place. The problem is the bony housing is in the wrong place. And that's why this splitting this up into 3 segments, the first segment is to move the upper bony housing to the right place.
Interesting. Yeah. So this is so different than when I was growing up, because I had braces, and from everything you're explaining now, there's probably still a need for that, but this is really addressing the underlying issues, the underlying structural issues.
Yes, because it's, as I said before, it's a bony housing growth and development of a housing that you need to breathe through when you sleep, that is related to an underdeveloped muscular tongue that doesn't need to nurse, that doesn't need to be strong, that doesn't need to extract milk, and then the not Purina, but Gerber's comes in with pureed foods, and mothers overcook food because the baby won't eat, broccoli, ice cream. Once they've eaten ice cream, they will no longer eat broccoli. They will cry until you give in, and that's what it's the baby's fault. I'm just okay.
Wow. Okay. That's excellent. That's excellent. Hey, so I think we'll wrap it up there. We've got more to talk about, but that is a very good explanation of what's happening with the development for the muscles, for the bony housing, and relating it to how people are experiencing sleep, the diagnosis of sleep apnea. And I didn't realize it was just, we're going off of data that's 40, 50 years old. I just, for some reason, I thought it was more up to date.
Well, I can go into my personal journey and why this is my opinion, which is based on me knowing, but we can do that the next time. We can also talk more about the diagnostics. We can talk more about outcomes and why this improves people so rapidly, so dramatically.
Yeah.
Right at the beginning.
Yeah. And I want to stress again, one of the reasons that we're talking about this is how important your dental health is to your entire well-being and your entire health. There's so often where I've seen people for regenerative services and they have an infection in their mouth. They don't know it. They've got mercury fillings, or they've got old root canal that is causing joint problems, whether it's arthritis, whether it's a particular joint. And when I started asking questions and I realized that they have not been taking care of their teeth, or they haven't seen a dentist like Dr. Vigoren, I refer them, because this is something that needs to be dealt with for your overall health. And it should be dealt with first, because you'll probably clear up a lot of issues just by seeing a doctor like Dr. Vigoren. So thank you very much.
We'll go into that next time.
Okay.
I had
good.
a lot of comments just from that.
All right.
I'll let you go.
Okay.
Thank you very much.
All right. You take care.
Okay, bye-bye.
Bye-bye.